My name is Lori Nisson, and I am a licensed clinical social worker by background. And we are in unprecedented times right now, trying to manage day-to-day living at home, maybe as a family caregiver, or maybe as a professional caregiver, caring for somebody with dementia. And the COVID-19 virus has really affected all of us. Many of us have, relatives or friends or family who've been directly impacted by the disease, maybe working in the trenches, in, law enforcement, or in the military, or in nursing centers, or in hospitals. And so we thank all of those people for their hard work, and then we certainly feel sad about the many family members and friends who are affected by the disease. And then, with these times of really social distancing and separating ourselves from our communities, this can be a very challenging time at home, particularly for family caregivers. So we thought we would start the conversation today to talk a little bit about living with dementia while we're coping during this particular crisis. You may have seen that I offered some virtual tips in the beginning of the program just to prompt you that we would start at 10:30. And that it's best to either join by your computer or by phone. If you do both, we've noticed that a lot of feedback and echoing will occur. And the program is really most successful if you kindly mute your phone. We invite you to share comments, feedback, and questions. There's a little icon like the one I have in my slide on the lower left corner, and you can use this to chat and to ask questions. And my colleague Janice Greeno, who's joining me for this discussion, will make sure that your questions get answered. So what I'm really hoping that we will tackle today is, a little bit of the nuts and bolts. I've had the pleasure of speaking with quite a few family caregivers these last couple weeks, as well as colleagues and a few folks from the media, and people really focus a lot on kind of the hygiene aspect of COVID-19. So we're going to touch upon that, but really my expertise and my background as a clinical social worker is really, and my interest is really, how do we manage these times effectively, psychosocially or emotionally, as we are being distanced from family, friends, colleagues, and there's a lot of emotions that arise as a result of these circumstances. So that's really what I want to delve a little bit more deeply into. So we're going to really talk a little bit about the challenges that you face as a family caregiver, taking care of somebody with dementia at home day to day in entirety solely can be incredibly intense at times, but even more so as a result of our current circumstances and conditions. And so we'll talk a little bit about the challenges you might face there if you're at home, but also really want to focus on the challenges of caregiving in a more assisted environment. What do you do if your person or somebody that you care about is in an assisted environment, a nursing home, assisted living, a care home, and you're not able to visit or see that person? And then, as I mentioned a moment ago, really want to explore a little bit more deeply some of the challenges that we have with this current pandemic and the restrictions that we face. And, it's not finite. It's a moving target. Every day we learn something different. So a couple of weeks ago, we were being, advised to just use social distancing, but kind of go about our everyday tasks. And then we were being told you really shouldn't be in, crowds of 50 or more. And now it's 10 or less. And in some countries, it's 2 people makes a crowd. And so we're really having to navigate this ever-changing environment without a playbook. And so I want to talk a little bit about what restrictions may be in place and how you can still live your life and manage it well. How do you take care of your person who has dementia and take care of yourself? And that's always a big question. Many times we're preaching to family caregivers to really take care of yourself and focus on yourself and your wellness. And we get a lot of pushback because you're already living, a 24/7 role just in caregiving, and many of you are caregiving somebody with dementia as well as children or other disabled family members, or working a full-time job, or the variety of other responsibilities that you have on your plate. So how do you take care of somebody else and take care of you during these particular circumstances? And then, this is a Q&A. So I really want to cover your questions. And, as this is uncharted territory, want to come up with some solutions that can help guide us as we manage these rocky waters. So I think one of the things we first want to start with is really, how do you take care of yourself and take care of your person with dementia under these circumstances? So, you may have experienced this in terms of, hygiene, and that often is a big challenge for people with dementia, as they're not remembering hygiene, as they're not focus too much on time and orientation and the steps that we want to take as we, do everyday tasks and implement hygiene at an even higher level. So how do we manage those kinds of things? But then, we're stuck together, and how do we really create some structure, some routine, and manage? And so I think, routine is really important. And I was having a conversation with Deborah Kahn. You may have seen her website. It's called Being Patient. She is a journalist whose mother has Alzheimer's disease, and she left her job at the Wall Street Journal to start this website because she really wanted to provide lots of education around clinical trials, but then realized that families needed a lot more of that. So she and I were having a conversation last week about, how do you take care of somebody at home, and why is routine and keeping time structured so important? Well, we know that, that people with dementia, and really all of us, require a lot of structure and routine. It's how most of us really function well. I mean, I've heard colleagues who say, my first week working from home, I was in my pajamas every day, but then I realized I really needed to kind of get it together. And so it's the same for someone with dementia. Having a predictable routine is critical to wellness. And certainly that creates lots of challenges when we're living at home, maybe just the two of us, or our small family, maybe a large family in a small space, and we're trying to keep a routine and time structured. And how do we do that? Maybe your person was going to an adult day program or a senior center or some outside activity that offered that person some better structure, activity, wellness, recreation. And it also offered you maybe some respite to go to your work day, or to take care of your children, or to take care of yourself, or to take care of your finances. So maybe you're not an activity therapist. I know I'm not. And so how do we keep that time structured, and what are some activities that could be really useful? My colleagues, Janice and Heather, created some worksheets that I think are great, and you can certainly, request them, and we'd be happy to send those to you via email. But one is really about living successfully in a small space, and how do you do that? And so one of their great suggestions, I thought, was really making space part of your routine. And how do you do that? What if you live in a studio apartment? Well, I think desk sales are up, right? Because people are trying to create separate places in their small environments so that they can separate time. So you try to use your bed mainly for sleeping, and then you try to move into an easy chair for reading the paper. Maybe you're sitting at the kitchen table or a little breakfast nook for having breakfast or tea or coffee. And then you're going to keep rotating around those spaces while you figure out some other times and opportunities to keep time structured. So it could be that they're just everyday tasks. Maybe you're trying to keep your environment exceptionally clean, and your person with dementia might be able to help you with cleaning on a limited level. So remembering that keeping tasks simple is going to be really important here. So, I'm not going to ask the person to, could you go into the kitchen and wash the dishes, put them away, and then wipe down the tables? That may be way too many steps, but I might be handing the person some paper towels and some cleaning spray and asking them to wipe down the table. Might be doing some laundry and asking that person to help with either sorting the clothes ahead of time by color, darks and lights, or if that seems overwhelming, folding is a task that might be really helpful to you and to the person, giving them a sense of purpose. Having been a social worker in aging for many years, somebody once asked me if I saw some common themes in the counseling that I was doing, both with people who were still working and aging, people who were retired, people who might have a cognitive or a movement disorder. And I said, one of the most common themes I see is that we all need to have a sense of purpose. And that changes based on our stage of life as well as our ability. So I think we want to use some simple crafts. We want to even do something like looking at photo books, photo albums, reminiscing about travel or positive times. I think the beauty of technology now, like we're seeing today, is that we can do things virtually. So it may be that we're just looking at pictures on a telephone or an iPad or some other device. Somebody suggested it last week. I thought this was a great idea to set up one of those picture frames that has just an array of pictures that are sliding by as a way of really just kind of reminiscing about the past. And the same can be true with a lot of screensavers on just everyday desktop or laptop computers. Setting up a slideshow that shows, old photos can just be a way to relax and reminisce. Organizing and sorting items can also be really helpful. And I don't know about you, but for me, getting outside is really important, if at all possible. Whether you are in a place where you have a patio or you're a place in a neighborhood where you and your person are still capable of taking a short walk, or even just looking through a window to, view birds, look at nature, to walk and breathe. So I think being outside, even for short periods of time, even in a small space or a limited space based on our current restrictions, is really critical. For somebody with dementia, having some sunlight is really important. So it helps trigger that circadian rhythm or biological clock that really tells us when it's time to be awake and when it's time for sleep. And then how do we stay connected during this time? It's really difficult, right? We might be used to, as we mentioned, some of our usual activities. For some of us, that's seeing colleagues at work. For some of us, that's seeing somebody in an adult day center or some kind of recreational activity or a gym. But now we're more confined to our environment and our space. And how do we stay connected to folks? So I was talking to a dyad yesterday. The gentleman has early Alzheimer's disease, and his wife is cognitively intact and well. And, really big part of their wellness is taking really long walks and going to their recreational center in the West Valley here, going swimming in the public pool there. And those things are now being removed. So I think they're trying to find different ways to incorporate exercise, whether it's walking just around the apartment, taking a walk outside, chair stretching. So sitting in a chair, doing some stretching, that could be useful. I know that there are some real simple tools that you can use at home to exercise, and the multitude of exercise videos ranging from simple to complex on YouTube or the internet is, there's a plethora now with so many people and athletes being confined to home. But I think the social connection is really critical, staying connected to family and friends. Some people are setting up, I've heard, virtual happy hours or coffee dates using the application of Zoom. And my understanding of Zoom is that if you don't have a subscription, you can use Zoom to set up a meeting for 40 minutes or less. Many people have FaceTime or an application like that on their smartphone or their other device. And so really looking for ways to really connect with people is really critical in this time. There's been a much greater awareness on the epidemic of loneliness, which came before the coronavirus. And in the UK, they actually have a minister of loneliness who really looks and seeks to help people stay connected. And so in this time of, really lots of limitations on the kind of social contact we can have, and feeling cooped up in our own smaller environment, that loneliness can really prevail. So we really have to fight it, and we have to be really creative, I think, and agile in figuring out ways to connect with people. Think about hygiene also as an opportunity to just set routines. So, gently prompting a person with dementia to wash their hands, or maybe even washing hands together with some soap as we're kind of modeling and prompting that person about what they need to do. Using a squirt of hand sanitizer in between, and using this opportunity to wipe down highly used surfaces and items very often, but setting those routines. So, we wash our hands after we use the restroom. We maybe have done some cleaning in the house, and then we are going to wash our hands again. And then again after, or when we're ready to eat some food or have some fluids. And then I think really we're talking for many people about how do you manage when you're a caregiver for somebody who's in an assisted environment. So, I think the restrictions vary again as we're learning day to day, things change. So, just a few days ago, we were being told, that we really, even by the CDC, didn't need to wear a mask unless we were coughing or had a fever or had some potential symptoms of a cold, flu, or potentially coronavirus. And then a couple of days ago, we've been told that really, it seems that one of the problems that we're just becoming aware of is that someone might have the virus, but be asymptomatic. They're not actually showing signs. And so it's really about taking care of thy neighbor, if you will, in that, you wear a mask and I wear a mask, and it's a much safer way to go about it. So, that can be really difficult in itself, trying to help somebody who is a small child or somebody with dementia who doesn't really understand what's going on, and you're asking that person to try to put on a mask. That can be really complex. So I think one way to go about it is to really stay in touch with an assisted living community. So, I can share that my in-laws are in an assisted living community, and there is absolutely no visitation. They moved in early in March, so it's very new to them. And, when we were trying to arrange visits, they're trying to be very protective of their residents. They've seen what's happened in Seattle and in other nursing centers and assisted living centers, where just like any other virus, once it comes into the community, it spreads like wildfire. And they're really trying diligently to protect their staff and their residents from coming in contact with people who may have the virus and may not even really know it. And then, so they're really setting these very strict guidelines about no visitation. So what do you do? That can be really difficult, in particular if you have somebody who's in the moderate stage of dementia, and maybe giving them a phone call is not reasonable. Maybe it's difficult for them to work technology or to even communicate on the phone. I think in individual situations, you want to, one, continue to be to that caregiver that's the advocate, and really inquire about what precautions maybe are being taken to keep rooms, surfaces, and hands clean. And then it may be that you really just have to work with the staff so that they can assist the person. I've heard of some communities that are ordering tablets so that folks who don't in their community, the residents who don't have access to those kinds of smartphones or devices, there would be a community tablet that could be scheduled for time for calls or FaceTime. in our case, we really felt like we wanted to lay eyes on our in-laws because this is really new to them. And so we have been setting up and scheduling regular window visits. So it's a lot of creativity. So initially, a few weeks ago, I was really pushing the staff. I think that we could have an in-person visit. Why couldn't we sit in the courtyard and be 12 feet apart? But again, they really are very protective of their residents, and rightfully so. So my next ask was, could we do a window visit? And so that seemed to work fairly well. My in-laws are on one side of the window. They're in a dining room, which has been, they don't have congregate activities or meals right now. So the dining room is empty. And there's a nice window there. So we set up time with the staff, and we're able to visit with them through the window and use phones so that we can hear each other well. So it's certainly not the same as being able to hold hands or give a hug or be closer, but we're making adjustments, and we're trying to be flexible, and a window visit is definitely superior to no visit. I think sending cards and notes can be really helpful. I think, there's really, as our technology has gotten elevated and we've gotten a lot more connected to technology, we've really lost the art of a phone call or phone conversation. And we've really lost the art of, handwriting a card or a note. And I think those tools can be incredibly helpful in two ways in this particular pandemic. I think actually writing down thoughts and feelings or sharing a little bit about your day on paper can be cathartic for you or for a sibling or another family member or a friend. If they want to participate in the wellness of your folks in assisted living, it's a great opportunity for them to share and to help out with rotating, sending cards and notes along the way. I think too, during this time, we know that certain items are scarce. And so finding out from staff who are working in these assisted living environments under unusual times, what items you can offer to be helpful, whether it's for your person. So, not assuming that they have enough tissue or paper towels or toilet paper, finding out, because you can't go into their room and check it out and figure out what's being depleted, finding out what may be needed. If you are feeling generous and want to help others, finding out maybe what some other residents in the community need that don't have family members or maybe the means to buy some of those items that are really necessary during this time, especially, and have little access to, to family and friends and limited deliveries. So how should you have a plan? I mean, when you think about it, if you're a caregiver, we're always talking about, and we have a whole class on our website called Planning Ahead, that one of our colleagues, Mary Lou, wrote, really, how do you plan ahead for care? So I think, like many of us in our life, we wait for the next crisis, right? We wait until something is really necessary to really act on it. And some of it, I think, is because we procrastinate situations that we feel uncomfortable about, that we don't want to talk about. Things like advanced directives and putting what I would want if I was at the end of my life in writing, what I would want, what I wouldn't want. I think making plans for care, whether it's in-home care or an assisted living environment, think how long you might have procrastinated or still are procrastinating that. But we always offer and recommend that people really should be putting plans in place for what if. So we know that taking care, being a caregiver in general for any disease state is incredibly complex and challenging. It can be incredibly rewarding as well, but it can be really challenging to really figure out the best way to take care of that person. And then with a progressive disease like Alzheimer's disease or even Parkinson's disease or another movement disorder, we're challenged in that we're taking care of somebody one day and then it's a progressive illness. So the person's needs may change day to day. And so we really have to prepare, because we know that taking care of somebody with dementia is exponentially more challenging than taking care of somebody with other disease states, that puts our own wellness at risk, right? And in the midst of a pandemic where any one of us, could be potentially exposed to the COVID-19 virus, we really have to have a plan in place. So, what happens if you or your person gets sick? I was listening to a news story yesterday where they were talking about, large families who are living in small spaces in really congested locations. You might have, in a large city, you might have 10 family members living in a 2-bedroom apartment. And how do you really separate people in these times of crisis if one person gets sick? So I think you really have to think about what happens if you're taking care of somebody at home, if you or someone else gets sick, and how you might handle that. How would you handle the situation in particular if you're caring for your person with dementia and you became ill? We had someone in our support group, this was a couple of years ago before this particular coronavirus outbreak, but she was, really well and healthy and taking care of her husband who had Lewy body dementia. And one day she fell and had a fracture, and she ended up in the hospital. Luckily and fortunately, his children lived in town only during the winter months. They were winter visitors in Arizona, and they were able to step in. But it really taught her a lesson that she would have been in crisis had they not been around. So really coming up with a plan B or C is really critical, and actually exploring what might be available and what might not be available. So it might be having some real frank conversations with close friends and family members and getting people to commit to stepping in if something were to happen. It might be connecting with assisted living communities and finding out if there are any in your area that might accept somebody if you were to become ill during this virus. Maybe even checking in with a primary care provider to find out what next steps would be if you or your person became ill. Because these are challenging times, and there isn't a perfect protocol in place, but at least exploring options is really critical during this time. So how do you take care of somebody else 24/7 and take care of you? I think we're really managing in very unusual times. And I think for any of us, it's easy to get stuck in a negative loop. So, in my counseling sessions with folks who have depression, I often say you have to get out of your house and out of your head, which to me means that too much time cooped up in your own home just thinking is not a good thing. Well, these are extreme circumstances, right? There's not many places you can go or should go. So you are going to be really cooped up. And so it's easy to really get stuck in this negative loop where we're trying to stay informed about what's happening, but we have a lot of news happening, and too much news can really lead to much elevated levels of anxiety and negative thinking in both you and your person with memory loss. I always say that too much news is really awful for somebody with dementia, but it's really awful for any of us. So I think we really want to think about, switching off that television, switching over to music, really focusing on shows that are lighter, whether it's the Food Channel, or maybe there's some televised spiritual programs, or Westerns, or even travel shows that you could watch. But I think we really want to be in tune to our own emotions here. We really want to know that many of us feel lots of fear during this really uncertain time where the game changes every day and the numbers rise every day of people who have been diagnosed with the disease and people who have perished from the disease. And so I think we really want to be careful about staying up to date, but not oversaturating, because that can really be overwhelming to our thinking and well-being. We are in small spaces, so we have to figure out ways to make our limited activities and our limited support thrive and really be creative. And I think as a caregiver, this really restricts our ability to have respite, right? So, people are saying don't have other people coming into your home, don't expose yourself to people that may have been in contact with other people who have the virus. So it really can create lots of stress and anxiety. So a lot of the work we do, in fact, we have one of our core classes is on ambiguous loss. What is ambiguous loss, and why am I talking about it today? Ambiguous loss is really a loss. It's defined by Dr. Pauline Boss, and she described it really as a loss that is unclear, that has no resolution, and has no closure. And Dr. Boss wrote a book called Loving Someone with Dementia to really describe how ambiguous loss applies to somebody with dementia. And I think both people with early dementia who have awareness or insight into their illness experience it. And I think many family caregivers and friends experience the idea that you are grieving the loss of someone who's present and absent. So physically present, but psychologically and emotionally absent or changed from who that person once was. And so it creates a lot of ambiguity. And I think dementia creates ambiguity, right? Because if you know one person with Alzheimer's or Lewy body or frontotemporal or whatever the disease state, you've known one person with that disease, right? We have a general understanding of the course, but each person is an individual. And so it creates a lot of ambiguity. So, often in our Banner Alzheimer's Institute and Banner Sun Health office, we have family members who are saying, how long is this going to last? We don't know exactly, right? There's a lot of ambiguity here. I think a pandemic magnifies the ambiguity that dementia brings. So with this virus, we really have a lot of ambiguity. We don't know exactly how long it will last. We can look at our experts in science and healthcare and their forecasting, and we can try to learn from experiences from other countries, like in Asia and in Italy and in Spain and in Britain. But really, we don't know exactly how long it will last. And we want to say that we can really make an impact by really reinforcing this good hygiene, these recommendations from the CDC, and really reinforcing and listening, even though we want to be out amongst people, really staying home. We can hopefully have an impact on lowering or breaking the curve, but we don't know. We don't have all the answers. We don't know how deep the impact will be here in Arizona or maybe here in another state. We don't know if things will quite return to the way they once were. You hear people talking, and maybe on news channels or in chat rooms or in your conversations with friends or family, when we get back to normal. But I'm not sure that things will ever return exactly to the way they once were. And so understanding ambiguous loss here, I think, really helps us to give a pathway for us to accept and live with a new reality. So as I teach the concept of ambiguous loss with dementia, I say we let go of what you can't control. We have to let go of trying to control dementia. We have to let go of trying to find an over-the-counter supplement that's going to cure a person. As far as we know, we don't have a cure or a way to arrest the disease. We have opportunities to live well. We have opportunities to explore with our dementia specialists what medications may slow down the disease, slow the progression, and other medications that can treat symptoms to help our person and to us live a better quality of life. So we let go of what we can't control. We cannot control dementia. We cannot control this virus or the pandemic, but we do take control of what we can, and how we see life is really what's important. So as Virginia Satir, the matriarch of family therapy, said, life's not what it's supposed to be. It is what it is. It's your interpretation that makes the difference. How you decide to perceive and live is everything. So we could choose to stay in that state of fear and stay locked there and feel very out of control. or we can dust ourselves off and think about what we can control, which is the recommendations from the CDC of living well and living safely. And we take control of what we can in our home environment. So perception is everything. So how do we do that? We try to quiet the mind. So when we feel out of control, we really try to remain calm. How do we do that? That sounds easy, but it's not always so easy. Just trying to stay in the present moment is critical, right? We as human beings spend the majority of our time in the past or the majority of our time in the future, right? So as a caregiver, you spend a lot of time thinking about, oh, I really wish my mom it was back 5 years ago when she was, helping me raise my children, and really such a different person than she is now. Or you're thinking, well, what do I do as mom's disease progresses? How will I manage? How will I implement care? All of these things. That what happens is we miss out on the moment. And there are lots of beautiful moments to be had in this current situation, but we have to choose to see them. So it's literally deciding to see our glass as half full and not always as half empty. So we try to remain calm and present. And when you get too deep in the weeds, when you get too overwhelmed, when you get frustrated, when you get fearful, when you get highly anxious, that's okay. Just remind yourself that it's time to take a step back. So how do we do this? So maybe you can't get outside. Let's take a look out the window. Let's use our breathing. Maybe it's just taking a deep breath and letting it out slowly. Maybe it's taking a deep breath in and holding it for 4 counts and letting it out slowly for 7 counts. I think we can use our breathing. We can use this mindfulness to be really in the present moment. In my earlier days of working in geriatric psychiatry and an inpatient psychiatric unit, I did a lot of group sessions, and often I had groups of folks who were high functioning, so they were maybe in the hospital because they were 60 and older and had depression or bipolar disorder or anxiety. And then mixed in this same program were people who were there because they had dementia with some complication. Maybe they had dementia with a behavioral disturbance or psychosis. Maybe they were having hallucinations or really extreme delusions. And there would be times when I'd have a mixed group of people, and I would often turn to relaxation. And I think you and your person, this is a perfect opportunity to take advantage of really finding the breath. And sometimes it's just as simple as taking deep breaths in and letting them out slowly. And I'll say relaxation groups were one of the most successful groups I was able to accomplish with these folks in these mixed situations where we had higher functioning and lower functioning people. So really breathing and encouraging your person to breathe with you. Or looking out the window and just focusing on something that looks interesting or beautiful. Maybe really focusing on how it looks, the size of it, the shape of it, the color of it, the tone, and just really focusing on something to help take your mind off of this anxiety and to kind of bring you back to your present state. Connecting with others. So, life is all about, that sometimes we feel like our neighbors on the other side of the wall have it better. The grass is greener, right? So I think what we need to do during this time is use a lot of compassion and connecting with others. There's always going to be somebody out there that has it a little bit easier, and there might be somebody, and there's probably plenty of people who have a lot more challenges than you do. So really using that compassion to get outside ourselves with the intent to benefit somebody else. So it might just be reestablishing connections. Maybe it's phoning a friend you haven't talked to in a couple of years. Maybe it's a distant relative. Reestablishing those connections. So, at Banner Alzheimer's Institute and Banner Sun Health Research Institute, the way we've done business has completely changed. So we used to offer, 15 to 20 in-person support groups or more in any given month. And we know that that's not a safe thing to do, but support is still very important and very real. So reestablishing those support groups, we have them telephonically, and many people have asked if we can move them to a virtual visual platform. So we use Skype or Microsoft Teams so that people can really both participate on audio perspective, hearing each other, but if people choose to or have the capability on their computer, they can actually see one another, and it really does make a difference. So really trying to think outside the box. I mean, I think we often think about that glass that's half empty. We can't meet our friends for coffee. We can't go to the park. We can't go to an adult program. There are lots of can'ts. We can't go to our church or synagogue. But really, I think there's lots of creative ways to get those needs met, those spiritual and emotional and support needs for nourishment. So, maybe your church or temple is offering telephonic or actual virtual prayers, during this week where there are many holidays that are occurring. Don't exclude those holidays if that's something that you've always done. Figure out a way to manage that tradition. It might not be that you're going to have a big dinner with lots of friends and family, but you could get out of your pajamas and get dressed. You might not be able to make all those traditional dishes or do things exactly how you once did, but you could do one dish that's traditional. You could listen to a service on television, or as I mentioned, your church or synagogue or spiritual group. The same thing with yoga. I know lots of people are connecting with yoga. They're taking classes through YouTube or other ways to really get in touch with themselves and stretch and move. Connecting with others. Ask yourself, how can I make this a better day for my person with dementia? And then reflect it back to yourself. What small thing can I do to better care for myself? Take it easy on yourself. So reflect that compassion back to you. Remind yourself these are really difficult circumstances, but you are resilient and you will make it through. Both caregiving and managing through a crisis can make you stronger. Flexibility increases your strength and your agility. But the adaptation of any tough situation requires you to decide you're also going to see the upside of the situation, not solely the losses and challenges. So as Dr. Boss says with ambiguous loss, it's important to grieve as you go. This is a scary time. It's okay to grieve that lost physical connection. It's okay to grieve the loss of jobs, the loss of family members and friends who may be becoming ill or taken by the illness. And that's normal. But we also have to balance it. And we have to figure out ways to tolerate and get more comfortable with the uncertainty of life. It really increases our maturity. So what does that mean? So, I think we all thought our lives were very predictable, and we knew what to expect before the pandemic hit, or maybe before Alzheimer's hit or touched our family. But life is really unpredictable and ambiguous. So I often ask people to remember back to when you were 18. Maybe you were graduating from high school at that time. And remember back then what you thought your life was going to be and how it was going to turn out. And how many of you, and I won't ask for a show of hands since we're remote, but how many of you can say that your life turned out exactly the way you thought it would? Probably none of us. And so we learn to tolerate and get comfortable with the uncertainty of life. It increases our maturity. And we can cease resisting these challenges and being frustrated in the situation and start to go with the flow. And know that these challenges create resilience. They make us better. And so what it teaches us is it helps us to look beyond where we are. It helps us to focus on making this life where we are now and how we're managing day to day the best it can be. And it also requires us to think about what we might do differently when things change. So I think there's lots of opportunity to think about our wellness now and how what we've learned from this experience can help shape us as human beings, help us grow, and actually help us be better in the future when we can hopefully get through this pandemic and live a better life. So now, because this is really a Q&A, I want to reflect back to you and your questions. And I know my colleague Janice is noting if there are people who are writing questions in your little chat box, please, we invite your questions that you might have during this challenging time, and I'll do my best to try to address them.
And this is Janice, and I don't see any questions yet, but if you can see, I just want to remind you that there's that little bubble in your bottom left corner, and that if you click on that, you can add your questions there. But while you're thinking of some questions, I've got a couple questions. I'm wondering, Lori, if you can share with us, what are the challenges that a caregiver may face in caring for someone with dementia at home right now that might be different than other times?
Well, I think respite is probably a big one. I mean, often we're relying on other people to help us with this journey. So one of the things I often counsel family members when I have the pleasure of working with folks in our clinics is when is it time to ask for help, and knowing that for most people, the person, as they progress through the disease, because this is a long disease, right? So, it's 8 to 10 years on average. Some people it's shorter, but some people live longer with the disease. And as the person declines cognitively, they also decline functionally. And so not only are they needing lots of verbal cues and support and supervision, as the person moves into the moderate and then advanced stage, they're needing a lot of hands-on care as well. And so often in the moderate stage, we're really, the care load can become so high that this is often when most people implement some respite, whether it's other family members, whether it's using volunteer organizations, whether it's hiring some paid caregivers or professional caregivers, using an adult day center or life enrichment program to offload some of that responsibility, but also to structure that person's time. As well as this is often when in the middle stage, when people start looking at some kind of assisted environment. Maybe you were kind of looking at an assisted environment, but now that the pandemic has ensued, that may not be an option for you in the near future. So I think the care load gets high, so figuring out a way to get some respite can be really important. And then I think really, using this opportunity to really take advantage of managing in quarantine, if you will. So I think, Janice, I think you said it best, in the handout that you created for our team and for people and families about living successfully during this time, is things like reducing clutter. So clutter can be normally distracting. In fact, a lot of us have clutter, and that's the thing we procrastinate, is getting rid of clutter, right? In fact, I had an old friend of my father passed many years ago, an old friend of my father's who sent me some old pictures of the two of them, and I just got them this week, and I think I imagine it's because he is cooped up at home and spending time decluttering his environment, and has come upon some photos from the past that really were, impactful for him. So I think it's a great time for spring cleaning, using this time to organize these messy spots, really try to reduce clutter. I personally think that exercise is critical during this time. Spending too much time in your own head is not healthy for any of us, right? It leads to that negative thinking we were talking about. So without being able to get out to the gym or the pool, we want to use exercise at home, because it's really healthy for us, and it's also healthy for our person with dementia, because we know that as the day goes on, that person becomes more fatigued, And the late afternoon or evening can be a time when they're really more restless, more agitated. You may even have heard of that pop psych term called Sundowning, where we have someone who in the day is really angry, upset, and distressed. I was talking with a dyad yesterday, and his wife is his caregiver, and they were both actually saying that late in the day is a really rough time for him, and he becomes very short-tempered, and she has a really hard time managing it. She at times was even feeling, not safe. So how do we handle this situation? So we talked about, the importance of exercise, the importance of structuring time, the importance of during the late afternoon. That's a great time to get rid of the television, to not be doing any complex tasks, to be turning the lights low, to be playing some soft, relaxing music. And we talked about their favorite music, for example. We talked about not talking a lot when he's upset. We talked about her exiting and telling him that, she really needs a break and she's going to go in the other room and relax. And she said she might even, step outside of the house if she needed just some quiet time. But I think exercise, whether it's dancing to your favorite music, taking a walk, walking in place or walking around the apartment or the home can be really helpful. Cleaning can be a form of exercise. I will admit that's not my favorite one, but using a vacuum cleaner or pushing a broom can be an opportunity for exercise. Stretching is really helpful for any of us, right? Especially because for those of us who are caregiving and working from home, we may be sitting in front of a computer, we might not be moving much. And so encouraging ourselves and our person to take a stretch break, or do regular exercises or chair yoga can be really helpful. A caregiver that was on one of our support groups last week said that her mom is in an assisted living community, but she herself is finding that she's not, stretching and exercising enough. So she's actually set some alarms on her phone a couple of times a day to remind herself to get up from her chair and her desk and to move her body. And then I think with somebody with dementia, there's often a lot of apathy. So how do you get your person engaged when they're really apathetic? Their motivation is really low. So I think using a lot of directive action. I know you might not want to take a walk or move, but I need to, and I want you to accompany me. I really need some company. Try cooking together, using music, playing a board game, phoning a friend, looking at photo albums, reading letters or old letters aloud, doing chores, scheduling time for calls so that maybe your person could be engaged in a phone call while you take a quick break. And then looking for lots of activities online. I know that lots of museums and aquariums and zoos are offering a lot of virtual things that you could really take advantage of. I know some of our local adult day centers are doing virtual programming, as well as the Alzheimer's Foundation of America has lots of virtual programs. There are lots of memory cafes in your community and other communities that are ongoing now virtually. And the beauty of that is that distance no longer matters if you're participating in a support group or an activity virtually. So I think if you can't get outside, looking and opening up that window and looking at some sunshine. So really structuring day and allowing that person to forget when they feel overwhelmed or frustrated, or you feel overwhelmed and frustrated, just taking a break.
Lori, I love those tips. They are so good and they're so relevant to what people are experiencing. And we do have a question that's come up, and it is from Cindy. What is the best way to explain why people are wearing masks? And to what level do you try to explain what's going on?
That is a fabulous question. So I think it really depends on where your person is. If they're in the early stages, they might know enough at some points to know that there's some kind of virus going on. If they don't, if they're in the more middle stage, it may be okay to just share that, there's a very unusual virus going around, and, our physician or a doctor or somebody that person might relate to or respect is recommending that just for our own protection, that it's good for us to wear masks. So I think the more advanced your person is, whether they're, moving into the moderate stage or even beyond that, moderate to advanced, I think using, we always say less is more. So giving less details so that you're not frightening or overwhelming the person, giving less details because you may very well be having to repeat them because the person's short-term memory is impaired, is going to be best. I think also just not creating a lot of fear, and that's why I say, really not playing the news. I mean, I think one of the things that we see in people, particularly when they're living in a community that doesn't have a lot of activities, probably now because a lot of the group activities in assisted living have been minimized, or at home when we're not doing structured activities, we end up watching a lot of news, and that could create lots of fear, and too much information, I think, can be really overwhelming. So I think keeping things as simple as they can be, and if your person asks you questions, try to answer as openly and honestly as you can, and then try to use a lot of reassurance. We're taking a lot of steps to be safe, and that's what we can do in this situation to make sure that we're going to stay well.
Thank you, Lori. And we have time for one more question. We did get a suggestion that maybe you were struggling with typing your comments in. So we're going to unmute the phones really quickly and see if a question comes up from one of you.
This is Karen. I have a question.
Hi, Karen.
Hi. I have a couple that I know. They're in their 50s. They both work. The in-laws, the mother-in-law is probably at moderate stage. The father-in-law has macular degeneration, and they live alone. And they don't know what to do. They don't feel safe bringing anybody in to assist them, and the family doesn't feel comfortable going in for fear that they might spread something to them. Do you have some suggestions?
That's a great question. I would be a little bit concerned about not having anybody check on them. So is there an opportunity to do a virtual visit outdoors? Is there an opportunity to have a visit through the window, or does someone really need to do hand washing and wear a really good mask and just check in on them to make sure they're okay? I don't know, but another option, if they're available, but I imagine they still are, another option would be to think about implementing some kind of electronic device, whether it's a life alert program. Another person on one of our support groups told me that she uses an Echo or Alexa, if you will, so that she can check in regularly on her mom who is in a care facility. And then I would also look to professionals. I'd ask the primary care doctor what he or she would think under these circumstances. If there's grave danger of those folks not really getting their needs met, then I would say that it might be useful to actually have someone check on them, either from a distance or just checking on them through the phone.
Thank you.
Yeah, that's a tough question. These are tough situations. Did they have care before? Before the virus?
One daughter had been living with them and then going off for a few days, and now she's moving out. So
why is she moving out?
Oh, because she's 42, got pregnant, and decided to move to Pennsylvania.
Okay.
It's not a healthy situation.
Okay, so that sounds like it's more complex. I thought she was moving out because of the virus, and I was going to say, well, she might want to just stay put. But it sounds like a much more complex situation.
It is very
and
complex.
I think it depends on kind of what their care needs are. There are some communities here. I know somebody from our other support group said that her mom is in an independent living facility, and she does have dementia, and they still have caregivers coming in. They have them wearing masks and gloves, but she really cannot be left alone. And they know it's not the best situation, but they don't feel like she could manage on her own at this point. These are tough questions. Thank you for asking.
And thank you. Thank you, Lori, for those answers. Thank you for sharing your expertise. And as we wrap up our class today, Living with Dementia While Coping with COVID-19 Outbreak, we just want to thank all of you and let you know that there will be an evaluation. It's a survey watching your email. It's going to be coming to you. And we will, in the near future, have a recording of this class that you can share. And we invite you to sign up for our Beacon newsletter. And we thank you again for joining us today. Have a wonderful day.
And before you log off, I just want you to take a look at these couple questions and just kind of think about those for yourself. So really, during this time, we talk about ambiguous loss and really holding two opposing ideas at the same time, knowing that there's no right answer, that we have to trust that things will work out. And, think about this in your own situation. Think about during your caregiving experience in this quarantine, what you might have lost and what you might have gained. And if you're someone who's participating today who has early dementia, you might be thinking to yourself, during this experience as a person with memory loss, fill in the blank for yourself. I've lost and I've gained. And then I just want to wrap up with this quote that I thought was really prolific by Maya Angelou that says, "I can be changed by what happens to me, but I refuse to be reduced by it." And then so that you can continue to stay connected, definitely sign up for our Beacon newsletter. If you're into social media, connect with us on Facebook. Consider joining or participating in a research study. And then if you need care, our clinics and many other clinics are offering telehealth, either through the phone or virtually. So look at that opportunity and stay tuned as we offer more classes and events and support groups online.
Thank you so much, Lori, and thank you everyone for joining. We hope that you will join us again soon. Thank you and have a great day.